Now, Goal 6 of the Sustainable Development Goals mentions the need for persons to have access to clean water and good sanitation. Unfortunately, poor access to improved water and sanitation in Nigeria remains a major contributing factor to high morbidity and mortality rates among children under 5. The use of contaminated drinking water and poor sanitary conditions result in increased vulnerability to waterborne diseases, including diarrhea, which leads to deaths of more than 70,000 children under 5 annually. This is according to the United Nations Children Education Fund. Well, joining me to discuss this is Program Manager, Hazy Health Initiative, Choma Osakwe. Good morning. Thank you for joining us.
Thank you.
Now, when we're talking about safe water, before we even look at access, help us better understand what we're talking about. When you say water is safe, how do we mean?
Okay, so we can characterize safe water as water that is clean. You can it's safe for drinking. So basically, it's not dirty. It's not yellowish. It's not has any color. It's colorless. It's odorless. It's tasteless. So that's just a layman's way of explaining safe water.
Right. Now to talk about access. What's your evaluation of how well we have done as a country when we're talking about access to safe drinking water, not just in urban areas, but in other rural areas as well?
We've come a long way, I would say. I'll give us that. We've come a long way. The government has come a long way. Private sectors, non-governmental organizations have pitched in, and I would say we've done a great job. But there's still more that we can do because looking at our statistics, we still have over 26% of Nigerians have access to potable water. That leaves about 79% or so not having access to potable water. That's a bit of a margin, a bit of a stretch. So I think we still have a lot to do. We still need a lot of advocacy, a lot of campaigns, a lot of investment in the area of wash, sanitation and hygiene as well. So
advocacy on whose part now? If we are advocating for access to safe drinking water, is it for the people or who exactly?
Yeah, for the people.
They don't believe they need access to safe drinking water?
Oh no, they do. I mean, like advocacy in terms of getting investment into the wash space. So we need to speak out, let people know what the situations are in the rural communities, because I think that's where the main issue is. Rural communities, we do a lot of work in those spaces, and when you get there and see how they live, it's saddening. So I think we need to put a lot of effort into those areas. Yeah, that's...
Perhaps you need to paint us a picture of what the situation is like in some of the areas where you've worked, for perhaps stakeholders who are watching to understand what the situation really is and how critical it is for people to have access to safe water. Okay,
so at Hazy Health Initiative, we're currently running a project, that's a Clean Water Initiative project, supported by Aspire Coordination Trust Foundation, ACT Foundation. And through this, we're able to provide access to potable water in rural and underserved communities. So this takes us to communities, rural communities across Lagos, Ondo, Osun, Delta, Imo, all over the country, all over Nigeria, to go into rural communities and see what's really happening there. I remember one of the communities where we went to, and they had to go to a stream. It was a stream, and it was so dirty. It was muddy. And I asked, this water, what is it for? They said they drink it. They use it to bath. Domestic use, they drink it. Everything they do
cook with it.
They cook with this water. I'm like, wow. I'm like, why is that? Like, this all they have. That's literally all they have. And this is not just the only one. There are communities where it's, open well, it's a lot, it's a whole lot. Like, a lot of these communities don't have access to water, not even access to water, sanitation as well. So that same water, they defecate close by. So imagine the amount of infection going on in that community. So these are just a few of the scenarios I can paint. There's a lot going on in those communities. You get a lot of cases of diarrhea, children coming down with illnesses. We visited a primary health care center just beside it, and the matron was this is what she has to do with annually. Children always coming in sick, and this is as a result of the water. It was heartbreaking seeing the community leaders begging for water. I'm like, something as simple as water, as little as water. They were begging for it like their lives depended on it. And it's heartbreaking that people have to beg for water. Come on, water. So that's just brief of what we do, and we try as much as possible to provide access to potable water in those communities.
As much as possible.
Yes, as much as possible.
Now, one question is how education on the part of the people, understanding that when you defecate on the same water you are drinking from, that these are the issues. What's the level of education in these areas to also see how they can manage themselves as much as possible? Yeah,
so the it's right. When we find we're doing our data gotten from the field, we find out that it's not as if they don't know this is wrong. They know they're not supposed to. They know they're not supposed to. But it's like they don't have a choice. What choice do they have? They don't have proper sanitation facilities. So our project works in schools and primary health care centers, and in those schools students don't have toilets. So I'm asking Masa, so what do children do when they want to use themselves? And they say, oh, they go outside to this. And I'm talking to a young lady. I'm like, is this, do you know it's wrong? She said, I know it's not good, but what's my choice? What's my choice? So they know it's not right, but they don't have a choice. If there was proper sanitation facilities, proper access to water and wash, they won't have to. Coupled with capacity building, I think it would be a lot better. But at the end of the day, their response is, we don't have a choice.
Right. Now, let's look at government, the role of government in all of this, as well as the private sector. As much as government is the major stakeholder here, can it handle it alone?
Yeah.
How can it collaborate with perhaps other stakeholders in the private sector to coming to addressing these issues? And is the government even speaking the language of these people? Because if you need to do certain things for people in these communities, you have to understand their language and their needs to know how to communicate with them appropriately.
Yes, I think the government, they're doing what they can. The truth is the government can't do it alone. If we want to be entirely honest, the government can't do it alone. That's why we always advocate for private sector support and support from generally anywhere we can get it, because they can't do it alone. And that's why initiatives like us, come in to sort of support and assist the government in these areas. So yes, the government honestly can't do it alone, and we engage with the state governments during these interventions, and what we get from them is that they do what they can, but interventions like this are always necessary to help balance of the situation or the wash situation in these communities. So we work with a lot of
so where
support.
would you want government to improve as it stands?
Okay, all right, so I think they can do more, really. For me, I think what gets me most sometimes is the neglect, because when you speak to some of these communities, they say the government they don't care, they don't come to even check on it, they don't ask. So I think if they can even visit some of these communities, see what they can do, because it's one thing to have a need and want it to be addressing, like what's their need, what's their primary need, not addressing secondary need, like what do they really need. I think that would go a long way. Get data, use data to drive your interventions, and if they can't do that, I think we will be putting our funds where it's most important.
Absolutely, and that's a fine place to leave the conversation. Chioma Osakwe, Program Manager, Hazy Health Initiative. Thank you for your time on the program.
Thank you very much. Thank you.